It is 2 o'clock and we're going to go ahead and get started. Welcome everyone to the Black Mental Wellness Virtual Conference, Overcoming the State of Black Healing. Today, we will be discussing child mental health. And our session is called I Love You So Much, and we'll focus mainly on children's mental health today. So before we get started, just a rundown of how we're going to move through today's session. We're going to do introductions. After introductions, then we'll go into the panel discussion. After panel discussion, we'll have plenty of time to answer questions from the audience through the chat. Then after that, we will have closing remarks from our panelists. So let's go ahead and introduce our panelists today. All right. First, we have Angelon Edwards, who is a licensed master level social worker who has a career in the Grand Rapids Public Schools as a school social worker for the past 21 years. She has also been a field instructor for Michigan State University for over 15 years. She's a graduate of Grand Rapids Community College and Western Michigan University in Kalamazoo, Michigan, for both her undergraduate and graduate degrees. In 2017, she was recognized with an Excellence Award as a field instructor at Michigan State University. She has established herself as a presenter on the following topics: teen and self-esteem, establishing student leadership in schools, bully prevention, social intelligence, ethical dilemmas, and mindfulness in schools. In addition to being a social worker, she's a self-published author, PS10 radio host, the CEO of Positive Steps 10 LLC, which is a self-help organization, and the co-founder of Ladies of Mahogany, which is a social organization. She is passionate about helping and encouraging others to be and feel their best. Ms. Edwards enjoys music, roller skating, dancing, being creative, and spending time with her friends and family. Welcome, Angelon. All right, our next panelist is Kelly Mclean. Her pronoun is she and her. She is the co-founder of the Hope Ambassadors, a Christian coaching and personal development company that she and her husband have created. The Hope Ambassador was created to reignite hope in others and give them tools and strategies to overcome challenges, preventing them from living the life God has in store for them. As a growth strategist, Kelly works with women who have a strong desire to impact others through business and ministry. As a wife, a mom of 4, she has built several businesses as a stay-at-home mom. Kelly has helped others to overcome obstacles and challenges by identifying their God-given gifts and leveraging them strategically for success. Prior to becoming a growth strategist, Kelly earned her BA in psychology from the University of Michigan, her master's in urban economic development from Wayne State University. And today, Kelly uses her experience from the nonprofit and small business sectors to help her clients create and sell transformative services and products online. Kelly also has a workshop called The Purpose Revival Workshop. It's a self-paced course designed to help you connect with God, discover your purpose, and to commit to more intentional and a purposeful lifestyle. Kelly, you can connect with Kelly over on Facebook and Instagram, and also on YouTube at the Hope Ambassadors, and her information will be pinned in the chats. Welcome, Kelly. It's good to have you. Next, we have Dr. Dannell Petgrave. His pronouns are he, him, and his. He's a licensed clinical psychologist and an assistant professor at the Department of Psychiatry and Behavioral Health. He earned his PhD from East Tennessee State University and completed his postdoctoral fellowship at Cherokee Health Systems. His clinical interests include ADHD, anxiety, brief interventions, depression, health behavioral change, racial stress, and racial trauma. His research interests include Black African American health, health disparities and health equity, stigma, racism, and anti-racism interventions. He enjoys clinical practice, teaching, research, supervision, mentoring, and community engagement. In his free time, he enjoys a variety of hobbies, including reading, playing soccer, and playing the saxophone. Welcome, Dannell. Next, we have Shelly Ann Moore Thomas. Shelly Ann is a licensed marriage and family therapist and a credentialed behavioral analyst in the state of Florida. The name of her practice is Your Narrative Counseling and Therapeutic Services. Shelly Ann has worked within the field of both counseling and education for a total of 12 years. The population of children and adolescents are her first love when working within the field with families she is privileged to serve. Shelly Ann earned her master's from Nova Southeastern University and has presented at both Florida Association of Marriage and Family Therapy Conference as well as the Solution Focused Therapy Conference, where she reported her findings from her study on youth experiencing social media related depression. Welcome, Shelly Ann. Last but not least, I am Shirai Bradshaw. My pronouns are she and her. I currently work in Washington, D.C. as a licensed marriage and family therapist, a life coach, registered yoga instructor, and I'm certified in mindfulness and child and parent psychotherapy. I'm a self-published children's book author that focuses on social skills for children. I received my bachelor's of arts in psychology from Clark Atlanta University and a master's from Pepperdine University in clinical psychology as well. I've worked with various populations across the nation, including gang-affiliated youth, at-risk youth, incarcerated youth, and adults and families struggling with anxiety, relational issues, and trauma. I'm also a resident advisor with Our Climate, which is an organization that mobilizes and empowers young people to educate the public and public officials about science-based equitable climate policy solutions that build a livable world. My dedication is in mindfulness and my yoga practice, which keeps me very grounded and very energized as we do this very, very transformative and healing work. It's good to be with everyone. Welcome to all the panelists and welcome the audience. All right, let's dive right into our first question. Our first question is, how can parents support their children's mental health? And when should parents begin having conversations with their children about mental health? Shelly Ann, would you like to take that question?
Yes, I would. Hope everybody's doing well today as well. This is an exciting time. I just wanted to say that, so for starters, the age that I found in my practice for several years now has been the age around 3. So if you can start talking to your child, especially at around 3, when it comes to thoughts and feelings, that'd be more of the age where you can delve in and figure out how exactly do they describe the feelings. Now, and you can do this by getting different facial recognitions from your neighborhood store. Like it could be your Dollar Tree, your Family Dollar, Walmart, Target, and sometimes you may even see these faces in their classrooms at school. Sometimes some of the teachers in primary school will already have them listed on the wall. And if you as mom, dad, grandma, whichever caregiver you are at that moment, all you would have to do is what I call create some type of a therapeutic journal. And you can take that journal and you can even keep it in the car. So maybe when you pick them up from the carpool or whatnot, and you have it on the back seat somewhere, you can have the stickers to go along with it. Now, the way that this type of activity works is let's say they pick up happy, and they put that in the journal for today. And then after they put that in there, you go home and you ask them about those feelings and try to really get curious about what happiness means to them. So ask them, well, what exactly occurred today that made you pick this face, And sometimes I've noticed in my practice that some kids will pick a face but describe something different. So then that's when you as mom, caregiver, guardian can then jump in and say, okay, well, this face and your description coincides more with this, sweetheart. I mean, and they may then say, oh, well, maybe I picked the wrong face. You know what I mean? And that's even leading to more further discussion. So even at 3, sometimes they can tell, but sometimes the information is so, thoughts and feelings, us even as adults, you know what I mean, can be so much. Absolutely. So for a little person, it can be even it can be heavy. I mean, even somebody just taking the crayon off of the desk at preschool. I've had my little babies come in. It's overwhelming. It's like,
Right.
How do I manage this conflict, Miss Shelly? You know what I mean? What can I do? How can I get that crayon back? Because I'm feeling all types of things right now. And I do, because I'm also a behavior analyst. I work with autism as well. So my clients, I get them as young as 3, typically in that form of practice. So even to work with not only my clients in my private practice, who are maybe 3 and older at times, the ones for behavior analysts, because I'm dealing with autism too, and it's neurological. Sometimes those feelings can be, if for my other 3-year-old who may not be autistic, the feelings can even be times 2 or 3 for them, for my children with the neurological disorders, which is what I deal with on the other side. So sometimes when you know what you're dealing with too, just having a therapeutic journal, and like I said, you can keep it in the backseat of the car, and or you can keep it at home. Maybe if they go straight to the living room, and that's what they do first, just so you as mom, dad, grandma have an idea of what's going on that day, and just get curious about it, and you'll be interested in what you find. And if they can utilize that book, sometimes they're more comfortable doing so.
Did anybody else want to jump in?
Agree with everything that Shelly Ann said. The only thing I would add is, I don't think there's a firm rule about age, but I would agree that you typically want to start having these conversations around the preschool age. And I would encourage folks to have a developmental perspective and have a long-term perspective. So it's not like you have the mental health talk and then you're one time over and done with, but you want to sprinkle these conversations throughout their life. And the conversations you have with a preschool age child is going to look different from the conversations you have with a teenager, of course. Some other kind of core guiding principles I would also like to share is, I would encourage parents to, try to be a positive role model when it comes to having conversations about mental health, and try not to stigmatize conversations. I would also recommend being on the lookout for positive behaviors, and every opportunity that you get to reinforce, praise, and give attention to positive behaviors you want to see more of. Also, develop a strengths-based mindset and be on the lookout for what are your child's strengths. Try to cultivate those strengths, especially social skills, because you want to make sure that they're able to make develop pro-social friendships with peers that are good role models for them as well. Be involved with the school, make sure that the school is a safe and positive environment, have a relationship with the teachers and the principal and the staff. And last but not least, I would also emphasize having a routine where you're taking care of their physical health. So being mindful of having a good diet for your child, making sure they're getting good sleep, and also making sure that they are being physically active. So that's all I would add.
Thank you. That's very helpful. All right. Next question I have for the panel. What are some useful mental health practices that can be implemented into your child's daily life that will benefit their mental health now and for the future? Angela, can you help with that question?
Sorry, most definitely. Really just make sure you're looking for opportunities. So whenever your child is experiencing any kind of emotion, I definitely agree with Shelly Ann and Dannell just about talking with children as early as you can. But when you see an opportunity, like when they're crying, helping them to learn how to use your words and labeling feelings, matching, not only just recognizing faces, but giving them the language so that they can learn how to communicate. I feel sad, or I'm mad, or I don't like what you did, and letting them, not shaming them for voicing those opinion or those feelings or those thoughts, because when we do that, we suppress them and make them feel like it's not safe to talk to me, or it's or I don't want to hear it. So we just want to create opportunities to teach them how to properly label their feelings, properly respond to things. Everybody's going to respond to things a different way, and that's okay. And let them know it's okay, but we don't hit. It's okay. We don't throw things. So those are the things that we need to do.
Thank you.
I wanted to add also, because I think that is absolutely correct. And just this afternoon, my 2-year-old even came to me and was like, I'm mad. And he had like the mad face, and it was an opportunity for me to say, okay, why are you mad? And have that further conversation. I also want to say that my husband and I, we do have to be really aware of the differences even between our children. We have 4, so our oldest are 6 and 7, and our youngest are 2 and 2 months old. And so seeing differently how each person responds. One may be prone to more like holding in, their emotions and then erupting. So helping them to kind of process and communicate before, he gets to that point. Or one is very expressive. And so we found that we've even had to deal with how we regulate our own emotions in response to that. And so, if we have one of our oldest is lashing out or responding and having like a pretty much a tantrum, I've noticed that I've had to watch my own physiological response to that and like feeling myself getting stressed or getting angry as a response, taking a step back and really, calm down before I approach it so that I'm not meeting that emotion with that, matching that emotion, but helping them to regulate it a little bit because I'm checking my emotions first and being that kind of calming, safe space for them to then calm down.
I think that's great. I would like to also add to that, Kelly. As parents are watching, it's okay to feel what we're feeling as parents. And sometimes we need to take a step away to experience that emotion privately, but then to go back and explain to the kids what that was that you're feeling. They're watching everything. And since they're little kids, they feel like sometimes it is about them. And so we want to make sure that we go back and explain what that feeling was and that we were able to handle it and cope with it and how we were able to do so as well. But thank you. That was very helpful. All right, next question. Suicide rates among our youth have increased by about 60% over the recent years. How can we advocate for sufficient child mental health resources, and what resources should we advocate for? Dannell, would you like to address that? Oh, you're on mute. Uh-oh, you're on mute again. There you go.
Okay, what about now? Okay, I think there's a little bit of a lag here. Sorry about that. It's a very troubling issue, and I think it's an issue that, unfortunately, a lot of people don't think about as much because it's, when you kind of look at the problem in its face, then, it causes a lot of discomfort and distress. Suicide rates among youth are increasing staggeringly high. The good news is, we take the perspective that suicide is preventable. There's a lot of organizations that are doing a lot of really good work, and my advice to parents and people in the community would be to partner with those organizations. Some that I would recommend, checking out their websites would be the American Foundation for Suicide Prevention. I would also recommend checking out the Suicide Prevention Resource Center, and we'll see if there's a way that we can get the link for these websites to people who are here in attendance. I'd also recommend checking out the American Association of Suicidology webpage. These are large organizations that have, listservs where they can send out information about suicide updates related to suicide research, interventions, programs. You can figure out what are some local chapters in your community and what people are already involved in, how you can partner with them. I would also say one of the biggest areas that we can really probably have a lot of impact on is in the school setting. So, unfortunately, the vast majority of school professionals are not very well trained in suicide prevention and having suicide programs set up to respond to those kinds of concerns when they arise. So, partnering with these various organizations can, help you develop more resources that you can share with your Board of Education or the school personnel at your child's school, and see what you guys can do to work together to develop more effective programs. The process of identifying and screening for children, and developing a game plan on what you're going to do when when there are positive screens. So again, we'll get those resources out, but I think the best thing that we can do is advocate for more support and resources in the school setting, just because that's where kids spend the vast majority of their day.
Thank you.
I would like to add to that.
Oh, I just wanted to add to that. I'm Shelly Ann, go ahead.
Oh no. Well, I just wanted to just let some parents know that it's to find out which clinic in your particular state offers crisis services. So, for example, one of our clinics down here in Florida by the name of Henderson Behavioral Health. I used to also work for them from like many years ago, but I still remain affiliated with them because even in my practice, I make sure to connect my parents to their crisis line. So pretty much what happens is in our state, so you got to find out which one it is in your state. But in Henderson, Florida, they have a crisis intervention line. So pretty much, if your parent has that phone number, which I do give to my parents, if I'm not available in the wee hours of the night, what they do is they have what I call their 911 therapist. They're around the clock 24 hours. So they're the ones who, when you're a private practitioner and you're away, or you don't open till the next day, your client's parent can call that hotline. There'll be a licensed practitioner on the other end. They'll assess via phone to find out whether or not if you're in high need at that particular time, or if it can be de-escalated on the phone. Sometimes too, let's say that your child is in high need and it's 3:00 in the morning. They send out a crisis bus or van to come out to your home to do out the full evaluation. If they then find that your child then needs to go to one of our local hospitals that we're also affiliated with, so if you're seeing clients and you're dealing with suicide, you do have to be affiliated with a local hospital. What then happens is they take the child, your client, if they deem that they need that extra level of support, to the nearest hospital to be seen, and then of course they would then be, if deemed Baker acted, they'll be Baker acted there. I mean. And then you as the professional or your therapist, you as mom, if you do already have a therapist, they'll send that information over to there via your consent. So, and then if you don't have a therapist, at least the hospital that I'm affiliated with, they will then make sure that they attach you to one via their referral listing. I share that information because it's a service I've used for several years now with my clients, but each state, I bet that they have something like it, you know what I mean? And if not, hopefully in a nearby county that does extend the services over to you. But it's a great resource to keep on your fridge, especially if you do have a child who may be experiencing some suicidal ideation.
Thank you. Angelon, you wanted to jump in?
There's a lag in my, oh, sorry. Okay, yeah, so I definitely agree with Shelly Ann and Dannell. I just wanted to speak on the part of the school perspective, at least from where I am. Usually if we have students, which happens, on a weekly basis, of like students who are experiencing suicidal ideation, our first thing is to, like Shelly Ann said, for our local community mental health, provides a mobile crisis team that can come to the school or go to the parent's home and assess the child right there. And then what we also do is just request that they either go to the emergency room, a local hospital, or our local psychiatric hospital has an emergency room of its own. So just if your child is experiencing suicidal thoughts at home, go to the nearest emergency room and they will get you connected. And that's your first line of defense. Don't try to handle it on your own, and just make sure you're supported, and you want to have that professional intervention. You don't want to try to manage it or dismiss it, or try to be like, stay off of social media. Like, it's real. It happens often. I see it in the schools, like I said, almost on a weekly basis lately. So definitely address it. Go to the emergency room or your local community mental health. I also wanted to mention the National Alliance on Mental Illness. You can text that number. Your child can text that number at 741-741 and receive some kind of crisis support by a crisis volunteer, a mental health volunteer.
Sorry.
No, please.
Mention too. to really address sometimes the shame that can be associated with that, or the stigma and hesitation that could come from that. Sometimes we can know all the right things, but then when we're faced with a real mental health crisis, some of those former ideologies can kind of come up. And I've experienced that in the past where, I'm blessed to have a lot of professionals, clinical health professionals around me. But when facing my own mental health crisis, some of those old thoughts of, well, if I seek help, is this going to go on my records, or am I going to be separated from my children, and some of those things? And I just really want to address that because I think it's so important to really shift the perspective. Because if it's your child, and let's say they had a really bad cut or a really bad injury, you would want to hurry up and get some immediate attention for that without feeling like there's going to be ramifications or anything associated with it. And so in the same regard, if those thoughts do come up, really push past that to try to get that help for your child, and not feel or worry about some of the repercussions that could come from that, because ultimately it can be a life or death situation, and you do want to go ahead and address it.
And if I may say one quick thing, sorry, my connection was a little spotty, and hopefully this wasn't already mentioned, but I also want to share that sometimes there's a myth, a very pervasive myth out there, that if you talk to a child about suicide, that you're going to somehow implant that idea into their mind, right? And that has been disconfirmed. It's a myth. It's not true. And in fact, we tend to see the opposite. If you're able to have the conversation with children about suicide, one, it invites the conversation, but two, people typically get better and feel better once they start talking about it, because they feel that they're being taken seriously, possibly for the first time in their life. They may have discussed this with other people and have been brushed off or dismissed as attention seeking, but we really need to work past a lot of these myths that are counterproductive.
Thank you. That's very helpful. I have a question. How do parents create a safe and validating space for children that might be suffering with their mental health?
Yeah, I think it's important to, as a parent, to try to keep dialogue open. And I know even, when I was a kid, I remember coming to my parents and addressing concerns, and they didn't brush me off. They talked to me, but, I think a lot of times we have to really take a holistic approach to mental health. And sometimes we can, like you said, try to do it ourselves, or feel like we have to have all the resources ourselves. But sometimes it is above us. And that's why I think with all the expert panelists here, it's important for me even to glean from this. I'm taking notes, as you guys are mentioning things, because I think we want to, just be aware of where we can learn more, where we can get resources and support ourselves as parents, and know that, there are a lot of things fighting for our children's attention, and they can be in circles and things that we may not always be aware of everything that's going on. But I think if we can start at an early age with just kind of create an environment where they feel like they can talk to us and they can speak to us and asking more questions, and even when they tell us things that may be a little bit shocking, responding appropriately. So responding with their same level of engagement. They're like, wow, I can't believe that person said that. But then also being like, well, what did you think about that? And I always try to I try to get them to talk more than I'm talking sometimes, because I want to know how they're processing things. Are they, picking up on some of the lessons that we're trying to instill in them, and talking to their peers about that, or, how are they being swayed? And so that's, typically what we try to do.
And I would just like to add just one more thing to that. Also reassuring, just as parents, just reassuring your kids and letting them know that you're just there to simply support and help them, and also complimenting them for being having just enough insight into coming to you with an idea to assist in assist in helping your family to even become stronger than what you already are. You know what I mean? So the fact that they have that level of bravery to come to you, you know what I mean, that you guys can now as a team then work together to make the, team Petgrave or team Mclean, the best, the strongest and the brightest and the most, knowledgeable family when it comes to dealing with issues such as depression, anxiety, even suicidal thoughts, and just reminding your children that sometimes they're, what they think may be worrisome to the family can actually add, just add a better layer of not only cohesiveness but strength, and and just reminding them that they help contribute to that strength. That's it.
Thank you. Dr. Petgrave, your mic is off. Mic's still off. Muted. All right. We're going to go to the next question. Dannell, when you can come back in with your mic, you can just jump on in. So I have a question about mental health. So mental health knowledge is not very common for everyone. And so what would you say are some basic steps that parents or caregivers can take to start to learn the basics about child mental health?
Right, I'd like to jump in on this one just because, just from speaking from personal experience as a child of a teenager who struggled with mental health, the pediatrician was helpful. And nowadays they have the mental health assessment that you take right away, the child takes right away when they start their appointments with the pediatrician. Also, if you notice any behavior issues or any kind of emotional concerns or anything like that in your child, start to take note of it and really recognize when did this start, what might have happened around the time that it started, how long has it does it last, and you don't have to keep a journal of it, but just take note and then communicate that with your pediatrician, and they can even let you know, some resources or maybe some things to try. And it's a mental note for you to know, what do I need to do? But just make sure you're doing that, and also just be available mentally, physically, and emotionally yourself so that you're aware. Because sometimes we're so busy and caught up in our own stuff as parents that we missed it. We missed an opportunity, again, just of what happened. I know, just that's easy to do. So just make sure you're just being aware, you're listening to your kids, and you're also keeping track of okay, this change happened when we moved, so I'm going to take note of that. And if it, intensifies, or if the school's calling you, that's a time for you to start taking steps towards what do I need to do.
Thank you. Your mic is still muted, Dannell.
What about now?
There we go.
Okay.
Welcome.
I won't touch anything else. I'll leave it as is. Sorry about that. I guess the point I want to make, I'm sorry, the last question, I just want to also add that it's also really important to listen to kids without interruption, distraction, to not having cell phones nearby, the TV nearby, just listening to their concerns. So I guess related to this question, one of the things that I want to say is, I think starting off with your child's primary care provider is always a safe start. They know you, they know your child, they are going to be in the best position to know what is and is not developmentally appropriate. They can.
Oh no. Does anybody have any basic steps to add to that before we move on to questions from the audience?
Yeah, and I'm just going to add, because I definitely think having these resources are extremely helpful. But sometimes, when you're just in the fire, honestly, with kids, one thing that has been very helpful for me, honestly, my husband and I, is prayer and seeking wisdom in that way, because that allows us to be able to respond, like I said before, to like the individual needs of our children. And so, for instance, with one of our children, them being so close in age, they're going back to school now after having a year off of school and being at home. So that socialization piece has been something that's been something we have to work through. And so with my oldest son, for instance, I was able to identify that he needed some time to kind of like debrief when, coming home and getting into like the midst of things. So we kind of have them like, separate when they first come home, like go take their showers. And I know for me as a parent, taking a shower is a great time for me to like decompress. And like, I've noticed such a shift in him when he comes home, like instead of just feeling like, antsy and being irritable and things like that. Like he's been like, he'll come back down. He's like, ready to go for the rest of the evening. And so getting little downloads from like that has been really helpful. But really for me, I've had to like take the time to really be intentional about praying, specifically for our parenting journey and what that looks like and how we can contribute to that.
Thank you. We are about to take questions from the audience through the chat. So if you have any questions, please add your questions through the chat and we will take some time to answer them. As we start to, as people think of questions, Dannell, was there something you would like to add? Oh, you just got kicked off again. All right. All right.
Shirai, while we're waiting for Dannell to return,
All right.
I did want to share just a couple activities that we can do with our kids at home. I loved earlier Kelly and Shelly Ann just talking about like the labeling of feelings. The feeling faces, and you can play a matching game with them. Like she said, you can get them from the dollar store, family tree, whatever, matching game. You can even take pictures of your child and ask them to mimic what they look like when they're sad, what they look like when they're happy, when they're mad, and match them like a matching game. You can do a memory game with them. You can play goldfish with the cards or with the pictures, and they really enjoy that. Little kids really enjoy that. Also, just teaching our children how to express themselves in a healthy way. And one way to do that is through art, being creative in any kind of music, playing an instrument, sports. A lot of young people love to just, they need get that energy out for whatever feelings they have. And so being able to run, jump, and do all kinds of sports has been great for coping skills. Just breathing and being still and is great. The mindfulness piece, allowing them to do that. And also, you as a parent, making sure you're taking care of yourself so that you're modeling that for them. Like Shirai said, our kids are watching us. And so if we're taking care of ourselves and we're coping in a appropriate way, then our kids will most likely mimic that and be able to manage their feelings. But we have to teach them that. And sometimes as adults, we're still learning. So make sure that we're taking care of ourselves emotionally, physically, mentally as well.
Thank you. That was great. We have a two-part question from an audience member. And she writes, as a parent, if I suspect any delays, what resources do I have to gain more knowledge? And also, how do I gather support to help me navigate getting on the right path during early intervention? You're cutting in and out now. Would anyone like to take that question? Shelly Ann?
I'm actually rereading it right here.
Okay.
Okay, so there's a few ways to go about that. I think we had mentioned earlier about, speaking to, your pediatrician, and Dannell had also mentioned about, just the primary care provider. Those will also be good starting places because sometimes they'll be connected to practitioners, therapists in their area will be affiliated with their practice sometimes. You know what I mean? So you may be in luck there. And if you did notice anything, when I'm reading, if you suspect any delays, I'm not sure if you're speaking to more so cognition. So if you are, as a behavior analyst, what I typically tell families is to reach out to, if not just psychotherapeutic services, so find your nearest local therapist, but at the same time, reach out to behavior analysis services as well, because we deal with a lot of we do different assessments such as MAS, FAST, which are literally tests in which I have to give to see neurologically on a scale, and I have a graphs that I do weekly and monthly on children. And on that particular graph, anything that parent then tells me on my FAST test or my mass scoring test, these are testing that we do in behavior analysis. If there are delays, you might be able to get a more in-depth analysis. And I just want to share too that behavior analysis, a behavior analyst is not a therapist, and sometimes because it's known as behavior therapy, that tends to get kind of confused. These are typically people who are, it's known to be a form of therapy, but this person is literally studying the essence of that behavior and what allows it to thrive and live. But they're studying it in a way that is more intense. It comes with an assistant. And if there are delays there, you as a parent can get resources, either typically through insurance, and an assistant will be provided to your home to help with any delays in which you feel your child is experiencing. So that's the difference between behavior analysis form of what they call therapy and traditional therapy. So traditional therapy is typically once a week, and for 60 minutes. Maybe 2 hours, depending on the design of the treatment plan. But for behavior analysis, my technicians get up to 20, 30 hours a week with a family. And if you suspect your child to have any form of developmental delay of any sort, your behavior analyst would then find that, supply that person to your home, known as a behavior assistant, who they train. And that person can follow your child to school, to home, to the community, and get those delays worked on as early as the age of 3 years old. Okay, so if you are a parent that suspects that, trying to figure out which practitioner to go, I'm always a support of have your therapist and also have the behavior analyst and sign a consent form so they can work in cohesion for your family. But if you are anything developmental delay, definitely it's good to have the support of also a behavior analyst. Okay.
Thank you.
I wanted to jump into just from an educational perspective, because I am a school social worker. Usually your local school district has a diagnostic team. It would include a social worker, a psychologist, a speech path, an occupational therapist, a physical therapist, and they'll be looking at all aspects of that. And what Shelly Ann was referring to is a wonderful service that a lot of my families have taken advantage of. I've taken advantage of it for myself as well, for my own children, but also just the fact that school, because the school diagnosis for ASD, autism spectrum disorder, is different from a medical. So Shelly Ann would definitely be, her resources are definitely necessary for a medical perspective, but for a school perspective, you would need to tap into your local school district.
All right. Thank you. Did anyone else want to jump in on that question before we move to the next question? All right. The next question is, what are your thoughts on different ways children and adolescents cope? I'm interested on whether we sometimes misread students' emotions as negative behaviors when it could actually be something else.
Yeah, I think that, and I'm sure you guys are gonna have some more like really great tips and things like that. But I wanted to just give an example where I think we know how modeling can impact our kids, and a lot of times if you see your kid doing something like, "Where'd you get that from?" But I think we may underestimate how much they're actually getting from us. I know with my kids, we were picking up from school, and I saw a parent like really like harshly like discipline their kid like physically, and it really like broke me like down. And my kids was like, yeah, like the student hit the teacher today. And I was like, wow, like it was interesting that the student had lashed out physically at the teacher, but the parent was responding physically to the child. But sometimes we can look at those extreme examples and forget like our own little things. And so like my husband would bring it to my attention, even like, are we like, if we notice our children are complaining a lot or not being grateful about things, and he's like, are we complaining a lot? You know what I mean? And it can be subtle things like, oh man, like, this didn't work, or, you're trying to work at something, you're like, and how you're responding, they're responding. And so a lot of times we're looking at them and we're like, what's with the attitude? What's with the, like, let's come on, let's be positive. And then we're like, wait a second, maybe we're complaining more, in this particular area than we would even like or even notice. Or, he's like, are we modeling happiness? Are we smiling around them? So sometimes it's easy to look at those extreme cases and then forget, how they may be picking up even some of those subtle things from us, especially, again, I'm going to reference the pandemic, them spending a year being like immersed around us. And so we've had to like look at ourselves in that regard sometimes to respond to the behavior, when we may be looking at behavior and assuming like, oh, is someone treating them bad at school, or is something else happening, or, why are they lashing out, or why are they acting like this? And then having to kind of look at ourselves. I noticed my son, he was getting frustrated at my 2-year-old son because he was on his bed and messing up his bed. And at first I'm like, stop, why are you being so mean to him? And then I realized he was getting that from me because I'm very particular, like, don't mess with this and don't X, Y, and Z. And I had to like really take a step back and say like, okay, I had to kind of say like, I know you got that from mom, mom's going to work on that and correcting that. I want you to feel like you're welcome, to be close to me. And I also want you to model that for your 2-year-old brother. Like he just wants to be close to you. And so they can really be a mirror
Oh, absolutely.
what's going on around them, but also from us.
Absolutely. I know one of the behaviors that I've seen with children is they're triggered by either an adult or another kid, and all of a sudden they shut down. And so when an adult goes to talk to them, they're not saying anything. Automatically, the adult reads that as them being defiant. When it actually, those are some really big emotions that's happening on the inside. They don't know how to respond to it. Sometimes they don't even really understand what they're feeling, that immense anger or frustration, and they don't know how to express it. Being very careful not to say or do too much because they could get in trouble. They might want to cuss somebody out. They could get in trouble for that as well, right? So they are really trying to manage how they respond to this. And what they do is just preserve themselves, or preserving everything that they have. And that's often misread by adults. They're being defiant. And then the adult starts to escalate more because we've misread a behavior where they're just trying to cope. That's one of the many things that I've seen with our kids that we do. Anything else that you all have seen?
And to add to what you just said, Shirai, in terms of the way a child copes, I mean, even for my children with neurological disorders, I'll just start with with one of the ones I work with, autism. And children with autism, because they don't know how to yet self-regulate, they'll body rock, and they'll stem, so it could be it could be this, it could be the rock, or it could be the movement of the legs, and it's some type of repetitive behavior. And sometimes too, and they don't stop immediately. I've had teachers try to write it off as some type of, some level of defiance. And, the way you write, you write in the school system, and being that I was an educator for several years as well, I know that when you write things a certain way and it goes to the school psychologist and it adds to the referrals, they're only a step away from seeing me in my next phase at the therapeutic school. You know what I mean? And it's how it's designed. Whereas no, children with autism, for example, they stem and they body rock, or they have repetitive behaviors to self-soothe and to cope. And if more of even educational professionals have that level of knowledge sometimes, that the way you would then approach them would be, help me help you. And you could, you're obviously, maybe you're scared or you're nervous, maybe I switched your class and you're body rocking, and that's why you're not moving when I say so. What I've seen sometimes even in high schools, especially when I was growing up before I became a practitioner, was they would try to grab on the kids and make them do something, and all that does is further escalate a child who was literally trying to self-soothe. You know what I mean? But their self-soothing may not look like your other typical students who are not dealing with this neurological diagnosis. You know what I mean? So you labeled it as defiance when actually they were doing the best they could from what their sensory system has told them to do. And you could figure out a way to be of support, and whereas if the last classroom was where they were not rocking it, maybe we need to go there, and maybe we need to have an assistant to go there and gradually gauge them into this new class. So I do agree with you, Shirai, where you were when you said the way that they cope, just taking a moment to try to understand what they're trying to say and where that comes from.
Absolutely. Another coping skill that I've also seen with children is laughing during inappropriate times when things are supposed to be very serious, or there's a topic that's being brought up and they begin to laugh. And so adults or their parents or caregivers will assume that they're not taking it seriously. They think everything is a joke, when actually, once again, they're trying to self-regulate or trying to make sense of something that is incredibly uncomfortable. And so they might laugh. And so that's often misread as well, that, they think this is a joke, they think this is a game, and they're punished even further for their behavior. And so being mindful of that it could just simply mean they're uncomfortable. I know a lot of adults that do that as well. So Dannell, you want to jump in? Can we get you? There we go.
I will try one more time. Okay, I'm coming through.
You're coming through clear. Don't move or do anything different.
Sure thing. I had said this in the chat, so hopefully it went through before I got disconnected again. But what I would say is, behavior is complex. It occurs in context, right? And am I still there?
You're still here. You're going in now. Keep going.
Okay. What I was going to say is part of the context is, the child's teachers, the parents, and kind of this back and forth interaction between the two. But also part of that context is also the child's historical context. Are there basic needs met? Is there a history of trauma, right? And when parents and teachers, and well-intentioned, but when they start yelling or escalating their voice, they run the risk of re-triggering that trauma, right? So I would also, bear in mind, what can you control? What in the environment can you control? And what impact can that have on the child's behavior? I would also say part of it, too, is acknowledging the fact that, a lot of our education, I don't know about you guys and folks in the audience, but I didn't learn anything about mental health in my K through 12 education, right? I learned a lot about like Pythagorean theorem and all these different things that, I don't use in my day-to-day life forever. But, no one ever taught me how to cope with anxiety or manage depression or to recognize depression or to handle stress, right? And I think, the context in which parents grew up in is vastly different from the context in which children are currently being raised in, and they're dealing with different problems. And, what is their education? What is their modeling, right? They're getting a lot of their information from, say, TikTok or Instagram or Snapchat or friends at school who have other problems and are engaging in maladaptive behaviors. And we often accord a very low priority to mental health. And the system, or rather systems, are very reactive instead of proactive. It's not until there's a problem or a tragedy where everyone starts to get together and say, oh my gosh, what can we do about this, right? So I think we need to be proactive, not just in our parenting approach, but also how we talk about and have conversations about mental health, and how, and yes, it's good to teach kids how to cope with anger and depression and anxiety when it's occurring. But, I think like some other folks in the panel have been talking about, it's also great to teach kids how to manage that before it escalates and becomes a full-blown panic attack or a full-blown, diagnostic disorder. So hopefully that makes sense.
Absolutely, that does. Thank you, Dannell. We have a comment before we do our closing remarks. A comment was made. I think we all need to learn to be aware of the ways that children self-regulate, like laughing, and how to interact with that, as well as adults learning how to self-regulate as well. And I agree with that. One of the major things that I do in my practice, and I teach my adult clients and my little kids, is mindfulness meditation. And as we do that, it really it helps us strengthen our prefrontal cortex and allows us to self-regulate and have emotional control. It allows us to pause and return our thinking back to whatever we're focused on. So whenever they're stimulated or triggered, they have a moment to pause and not to respond or to react. And they have that moment to gather all the coping skills that they've learned or they're learning, and then pick which one that they can utilize that would best fit them and benefit them. It takes time, even as an adult, it does take time. But when we can teach our children this at a young age, I mean, how powerful would that be as they become an adult? To be able to just take that pause and to think about what the next steps would be before they react or respond. Keep us out of a lot of trouble as adults and children as well. So with closing remarks, we have about 4 minutes. If everyone could just say a word or two before we close out today, we thank everyone for attending our session today. Kelly, would you like to start with closing remarks?
Yeah, sure. Thank you. I was really glad to be able to be a part of this. I think that the information shared here and the resources, I was actually taking some notes as you all were speaking. And so I would just say, once you have this information, kind of like I said before, don't be afraid to use it if you need it. Don't give into like feelings of like denial or that, shame or things like that. If you do have something that's going on. And like I said, I know that we model a lot for our children, and that could even make us feel like, we want to deny when there's something that's going on. But really, it's so important to have that early intervention, as the person in the comments said, to really be able to go ahead and prevent a major mental health crisis or to address one if necessary. Also, if you are finding yourself really going through it, whether it's just a season or there's been some things, some challenges that you haven't addressed in the past. I tend to work with moms and women. So really, I know the power of addressing some of those things and how that even can affect your parenting. And so don't be afraid to get some resources and seek resources for yourself too, and prioritize your mental health so that you are not pouring from an empty cup. And so that's, what I would kind of leave with.
Thank you. And Kelly Ann's information.
Yep, at thehopeambassadors.com or on social media platforms at The Hope Ambassadors.
And her information is in the chat as well. Shelly Ann, would you like to close out or have some closing remarks?
Yes, of course, sure. This has been great, guys. Lots of information from everybody. So I'm just happy to be here. Honestly, the energy was nice. The comments and just everything today. This is like I'm like, oh, this is good. I'm looking forward to the rest of my day right now. But what I do want to say is that is just a tip that I typically give parents, because parents can be very hard on themselves, and I know the parents I work with are very hard on themselves. And one thing I would like for the parents here to leave with today is just know that there will be moments where your children will see maybe not the the best sides of maybe your relationship, and if you so maybe you have an argument that you don't mean to have in front of them, or you're in the car and they're driving and something between you and mom may come about. And one of the tips that I give parents is if you're going to invite them to the party, make sure to invite them to the after party. I mean, and what that means is if you and dad have had some type of a discourse and disagreement in the car, and you just tell the child to go to the room, maybe you do that, but what happens is that child never saw when you two really made up, and so they lose a lot of context in that time. And what I've seen happen is, that child will then go to school, and all of a sudden, you're noticing little behavioral issues. I mean, things that are not typical of your child. And I'll speak from experience with some of my clients. I thought mommy and daddy were getting a divorce because daddy, the way he left, but all of a sudden, daddy's back in the house. I don't know what happened.
I really like that. What was it? If you're going to invite them to the party, invite them to the after party as well.
I say that all the time. Yeah. And just be okay with that. So you don't have that pressure of feeling like, you know what I mean? You have to, it's going to always be perfect. Of course, you want to be your best self, but just know that you do have that option, because the after party is what's going to make that connection to how they will then be when they become our age even.
Thank you for that. Our time has come to an end, and we would like to make sure that we respect your time. Dannell and Angelon, thank you all. Shelly Ann, Kelly, thank you for being panelists today. Thank you all to the audience for attending, and we hope to see you throughout the conference today.
Thanks for having us. I appreciate it.
Thank you.